Hi, welcome back to my YouTube channel. For those of you seeing me for the first time, I would like to introduce myself as Dr. Rocha with specialty in mental health nursing. And I've been making several videos on different types of mental disorders. In my previous video, we have discussed about mental status examination, and today we are going to discuss about MMSE, mini mental status examination. Before we could proceed, if you haven't subscribed my channel, please do subscribe and share to others. So let's just straight away go into the topic. Mini mental status examination. So it is a screening tool which is used to assess the cognitive function of an individual, and it helps us to identify if a person is having any cognitive impairment. So the uses of mini mental status examination is that it identifies if a person is having any dementia at the earlier level, and it also measures some aspects like orientation, attention and concentration, memory, language, comprehension. These aspects are measured in this tool. So here we see this screening tool. Under that we have different areas what we are supposed to assess, and we have a maximum score of 30. You can just add them, the sum of the scores which are given here for each aspects are 30, and according to the score what the patient gets, we can categorize them. And for that, before we could just proceed further, see that you fill the patient's name of the examiner, that is you, whoever is assessing the patient, and the date when mini mental status examination is done. So coming to orientation, for this orientation we have 10 marks, 5 marks and 5 marks here. First 5 marks here are for year, season, date, day, month. Here we have 5 aspects. We are going to ask patient what is the year, what is the season, date, day and month, and for each answer we are going to give 1 mark each. So there are 5 here. So we are going to just give score according to how many they are able to answer. If they are able to tell only 3, then our score will be 3 here. If they are telling 5 correctly, then it should be 5. The same way, the next question what we are going to ask is, where are we? Which state, which country, town, hospital and floor. Which floor is it? Whether it is ground floor or first floor or second floor, like that. We are going to ask these 5 questions, like which state, country, town, hospital and floor. For how many ever correct answers they give, we are going to put the score here. So here the orientation we are having on the whole 10 marks for orientation. Next aspect is registration. So in registration what we are going to say is mention names of 3 objects like paper, pencil, table, and ask them to repeat those 3. If they are repeating the 3 correctly, then you can give score of 3 points. If not, you have to ask them, you have to give them another trial, repeat again, and see that they repeat those correctly. Like at least 3 attempts we can give them. So according to the response what we get, we can give the score. Next aspect is attention and calculations. So regarding attentions, if you just go back to mental status examination video, there attention and concentration is discussed in detail, like digit span test is there, and mentioning weekdays and telling the days in backwards, days of months, and repeating them in backwards, like that. Apart from that, also we have discussed like serial subtraction, 100 minus 7. We have to ask them according to their education level. Suppose they are graduates and postgraduates, maybe we can ask them to subtract 100 minus 7. Then 100 minus 7 is 93. 93 minus 7 is 86. 86 minus 7 is 79. 79 minus 7 is 72. Then like that, at least 5 answers we need to get. If they are able to tell 5 correctly, then we can give 5 score. And if they are below like maybe intermediate or 10th class, like that, you can ask 40 minus 3. Let them ask them to subtract 40 minus 3, 27. 27 minus 3, you have to explain them. It is 24. 24 minus 3 is 21. Same way, 5 answers, after giving 5 answers like that, we can stop. Otherwise, you can also go for 20 minus 1 if they are illiterates. And alternatively, spell world backwards. Like when we ask them to spell world backwards, they should give us this answer like D, L, R, O, W. If they are able to give these answers correct, then we can give 5 marks for them. Next aspect is recall. Here, initially during registration, we have mentioned 3 objects for them like paper, pencil, table. The same 3 objects we have to ask them to recall and repeat those. We have just asked them to repeat whatever he recalls. According to each whatever he says, object name, whatever he says, we can give 1 mark each. If he repeats 3 objects names, we can give 3 marks. Or if he says 2, then only score will be 2, like that. So the next aspect here is language. So coming to language, we can ask them like you can take a pencil or a pen and watch and say, ask them like what is this and what is this. They say this is pen and this is watch. You can give them 2 marks. And ask them to repeat the following: no ifs, ands or buts. Exactly this same wording has to be addressed to them. No ifs, ands or buts. If they repeat, we give them 1 mark. Then next one is 3-stage command. So in 3-stage command, what happens is like you ask the person, you give a paper to the patient, whoever is that, and ask them fold it into half. You can ask them to hold it in their hand. You can tell them hold it in your left hand or right hand. They are supposed to follow whatever you say, follow the instructions. So take a paper, hold it in your hand. Okay, fine, they hold it. Then fold it into half, keep it on floor. When we say they are supposed to place it on the floor like that. If they are able to follow this 3-stage command, each command, then you can give them score of 3 marks. Otherwise, if they are doing only following 2 aspects, then maybe 2 marks or 1 mark, whatever it is. The next one is read and obey. So you are going to write on a paper before itself, before going to the patient. You write on a paper, show this to the patient and ask them to follow what it says. So they have to read it, close your eyes, then they should follow that. If they do that aspects, then we are going to give them 1 mark. Then write a sentence which makes some sense. Sita is playing, or you can say anything which consists of a subject, noun, or verb which makes some sense. You can ask them to write a sentence. My name is Roja, or I am admitted to hospital on, or whatever it is, which makes a complete sense. If they write one sentence, then you can give 1 mark here. The next one is, this is a pentagon which has 5 sides, 1, 2, 3, 4, 5. 2 pentagons, they are intersecting. So you can just exactly draw this figure and ask them to copy the same design. Give them one paper and ask them to copy the same design and show. So if they are doing it well, then you give 1 mark. Finally, you have to calculate the total score, what they got. And according to that, we can evaluate the person. And apart from that, you can also assess level of consciousness. Along with that, say whether they are alert, drowsy, stupor, or coma. Now coming to scores of mini mental status examination. If they are scoring somewhere like above 23, then that is okay, fine. But if they are scoring between 18 to 22, then we can say that they are having some mild to moderate cognitive impairment. And if the scores are below 17, below 18 and 17, we say that they are having severe cognitive impairment. That is how we just assess patient using this mini mental status examination tool. I hope you all got it. I hope you all have understood this one. Try to practice as many as you can so that it will be like easy for you to assess patients, their cognitive function, level of functioning and all. We'll get back soon. I hope you didn't forget to subscribe and share this channel. We'll meet soon. Till then, bye bye. Thank you all.